Welcome. My name is Kelsey Harper and I am a registered nurse and care coordinator. Today I will be discussing care coordination with you. Nurses are on the front line of care for their patients. Nurses spend most of the time with the patients and usually understand what is best for the patient care-wise based on that. This presentation aims to dive into why care coordination is so important and the impact it has on patient outcomes. I will also discuss the strategies to coordinate care with the members of the interdisciplinary team. We will explore care coordination to make the patient care experience better overall. Effective collaboration. Patient engagement, also known as PE, involves the collaboration of many aspects of the healthcare team, which also includes the patient, their families, the provider of the patient, and the nurse. This will enhance the healthcare experience. That was found from an article from Vogt and other authors in 2022. Patient engagement has many benefits to it. For example, tailored educational resources, personalized programs, and services that benefit the patient. Overall, it enhances the patient experiences and enables better outcomes as well as reduction to hospital visits and stays. Also from that same article by Vogt and other authors in 2022. Establishing rapport with the patient and their families is very important for effective communication. There are many communication strategies that can be used in addition, which include but are not limited to open dialogue. Open dialogue is very important for the patient, so the patient is aware that they are heard and information is translated to them in a way that they understand. This will help them with informed decision making. That was also found from the article from Vogt in 2022. Another strategy would be education to the patients in order for them to make informed decisions. The nurse should keep in mind intellectual respect and cultural sensitivity when doing so. The patient should receive updates on their care and their treatment progress to further evaluate patient-centered care, enhancing overall quality and outcomes for the patient. Effective collaboration is very important in outpatient settings. This is especially important with medication adherence. Specific education should be given to the patient in a concise way that they understand. That was found in an article by Hargis and Castell in 2019. Interchanging these interventions with culturally sensitive strategies, such as translators and outreach events to these patients, will help with cultural disparities and improve the understanding of the patient as well as better outcome for all patients. Change management and care coordination. Changes in healthcare within hospitals sometimes create major alterations for patient care. It can lead to delays in patient care as well as changes in the way the patient is used to being treated for with a specific disease. That was found in an article by Harrison and other authors in 2021. When hospitals adopt new technologies or have a change in staffing patterns, it encourages interpersonal dynamics and collaborations within the members of the healthcare team. Any change in the way the hospital or healthcare facility does something can affect the patient's care in a good or a bad way. This changes the patient and their family's perspectives and perceptions of quality of care. Effective change management within facilities shape the patient's opinion of the care they receive from it. Transparency between the caregiver and the patient is very important, and maintaining clarity about the treatment regimen, integrating new technologies and workflow aids in making the patient experience even more helpful, along with strategies that the patient is directly involved in. These strategies can empower the patient's decision-making process and enhance their one-on-one care. Care coordination and ethics. The Nursing Code of Ethics plays an important role in care coordination. Ethical decision-making is made possible by commitment to welfare of the patient, benefits, autonomy, justice, and avoiding any harm to the patient. When establishing care plans, healthcare providers are sure to include integrates and effective patient-centered care in the delivery of that care. Beneficence is the act of making sure the patient is properly taken care of. Coordinating care plans have the highest priority of welfare to the patient. Autonomy is the act of making sure the patients are making their own educated and informed decisions about their own health care. Coordinated care plans encourage patients to be involved in their care and make decisions within it. That was found from an article from the American Nurses Association of 2024. Justice is the act of advocating for the patient regarding their health care. Coordinated care plans strive to address healthcare disparities by creating equal healthcare to all patients, also found in an article by the American Nurses Association of 2024. Non-maleficence is the act of doing no harm to the patient. Coordinated care plans are set in place to aid the patient in getting better quickly and efficiently. These care plans minimize the risk of harm to the patient in every way. Policy provisions and patient experiences. Healthcare policy provisions hold significant influence over the patient experiences and outcomes. Provisions targeted to create more access to healthcare or by looking into various healthcare disparities are going to enhance the patient experience. That was found in an article by Levine and other authors in 2022. Policies that focus on the financial aspects of quality improvement can impact patient outcomes due to having treatment regimens or quality of care. Some policy provisions, such as Medicaid expansion, are positive additions to healthcare access, utilizations, and cost. These lead to improved outcomes and experiences. That was also found in that article by Levine and other authors in 2022. Overall, the healthcare policy provisions are very important in shaping the way care is delivered, patient experiences, outcomes for the patient, and the creation of policies through ethical decision making. Nurse roles in coordinating care. Nurses are a very important aspect of care coordination. Using their frontline care experience with the patient and collaborating with the rest of the healthcare team to deliver proper care that they have been proven to be a vital part of the process. They must be proficient in communicating and be able to properly communicate with the patient, the family, and the healthcare provider and bring all the information together for better understanding. The nurse's contribution to care coordination improve patient safety, patient outcomes, and overall quality of care. We, the nurses, are the glue to every aspect of healthcare coordination today. Conclusion. In conclusion, care coordination reflects foundational principles of the nursing profession and guides patient care. Through effective communication, proper management of care, recognition of moral principles, policy provisions, and overall care for the well-being of the patient, nurses can migrate through the healthcare process and focus on the well-being and satisfaction of their patients. As nurses, we make sure to optimize care coordination. After all, the patient is by far the main concern and the reason why we wake up and do what we do every day. I also included a reference page with the references that I use throughout this. Thank you.